Welcome to the Sydney Southeast Asia Centre's 8th ASEAN Forum, where we will be looking at ASEAN's response to the COVID-19 pandemic. My name is Thushara Dibley, and I'm one of the Deputy Directors here at the Centre, and I'll also be your host over the coming week. We're really excited to be presenting the ASEAN Forum online for the first time and reaching out to some new audiences as we explore this important and timely topic. So before we begin, let me explain a little bit about what the Centre is. The Sydney Southeast Asia Centre is in its 8th year here at the University of Sydney. We represent over 500 academics here at the university across a range of disciplines who work on Southeast Asia. Our role as a centre has been to bring those academics together and provide them support in their research of the region. And it's also to create a community of scholars within Australia, across the region and across the world. And we invite you to become a member. There's lots of information about what is involved if you have a look on our website. So our event over the coming week will feature 4 experts from here at the University of Sydney who will be looking at ASEAN's response to the COVID-19 pandemic from different disciplinary perspectives. We have presentations on government responses, economic responses, health responses, and also on the impacts of the pandemic on livelihoods of people in Southeast Asia. Each of our experts will present a 5-minute video. And for those of you who are interested in finding out more, you're welcome to listen to the 15-minute podcast that I have recorded with each one of them. So to set the scene of what's been happening in the region over the last few months, I'll be talking a bit about how the virus came into the region and how ASEAN as an institution has responded to the pandemic. So the first reports of coronavirus emerged from China in December 2019, but it didn't take long for cases to emerge and begin spreading across Southeast Asia. By the end of January 2020, almost all of the countries of Southeast Asia had reported cases of coronavirus, and by March, all 4 of the remaining countries had also reported cases. The initial cases were mostly identified in travelers from China, Europe, and the USA. But through a combination of patchy and slow government response, as well as a few key super spreader events, it didn't take long for local transmission of the virus to occur. A key event that contributed to the spread of the virus across Southeast Asia was a gathering of 16,000 people in Malaysia at a religious event in late February. 1,500 people attended this event from overseas, and it resulted in over 600 cases of coronavirus being detected, the majority in Malaysia, but there were cases in Brunei, Thailand, Cambodia, Indonesia, and Singapore detected as well. Governments of the region responded quite differently, as Aim Sim Peng will discuss in more detail in her podcast and video. In brief, some countries locked down their borders quickly. Singapore, Vietnam, and Brunei quickly closed their borders to travelers from China in late January and early February. Vietnam declared a national epidemic in early February and quickly closed its borders to travelers from other global hotspots. It took other countries until mid-March to begin to close their borders, and national lockdowns began to happen around this time as well, but at different rates and at different times, starting from mid to late March through to late April. There was an equally diverse response in the health sector, as Greg Fox will outline in his video and podcast as well. So a key feature of how governments in the region responded initially was that it was quite diverse. There was no consistent approach to how each of these countries responded to the pandemic. So a map of the mortality rates of coronavirus over time in this region can help us understand a little bit of the impacts of this mixed bag response to the virus. There are 3 key points that I'd like to make in relation to the graph, which shows mortality rates in each of the ASEAN countries over time. So the first point is that the low mortality rates are both a signifier of an effective response in countries like Vietnam and Thailand, but they are also an indicator of weak public health systems and low testing capacity in places like Laos, Cambodia, and Myanmar, where the low mortality rates may be actually hiding a much more serious situation. The second observation is that the high mortality rates of places like the Philippines and Indonesia should ring warning bells for how this pandemic will play out over time into the future. Neither of these countries have had coherent strategies in place for managing the pandemic. This is reflected in those high mortality rates, which may not even be capturing the full picture of what's going on. And this situation paints a worrying picture for how these countries will emerge from the pandemic. The final and perhaps most obvious point is that it's such a mixed picture across the region. Southeast Asia includes countries that have had some of the world's best responses to the pandemic, as well as some of the least successful responses. And this has implications for how we understand and think about the way ASEAN as an institution has responded to the pandemic. So against the backdrop of rising numbers and confused government responses earlier this year, ASEAN took some time to formally respond to the crisis. During the early stages of the pandemic, in January and February, the countries of Southeast Asia didn't have access to the same quality of information about the disease and how to prevent its spread. There was a real absence during this stage of regional coordination and support. In large part, this was because ASEAN, like many other institutions, didn't have an actionable plan in place for how to respond to an event like the spread of COVID-19. And so as the pandemic took hold across Southeast Asia, the institution found itself on the back foot. By April, however, ASEAN had organized its first ever virtual special summit, where it released the declaration of the special ASEAN Summit on Coronavirus Disease 2019. The declaration focused on how countries of the region should work together on their public health response and making sure accurate information about COVID-19 was available to all people, the well-being of populations affected by the disease, ensuring supply chains remained open, and reallocating funding for managing the pandemic and for mitigating the effects, economic and social effects of the pandemic over time. The key theme of the declaration was that the countries of ASEAN needed to be thinking about the interests of their neighbours as much as the interests of their own country. So some scholars of ASEAN see the declaration as a unique opportunity for the states of ASEAN to come together to manage the health and economic challenges that have emerged as a result of the pandemic. But for this potential to be realised, states have to be willing to cooperate. As we've seen from the beginning part of the pandemic, states were making unilateral decisions about closing borders, at times implementing border closures that their neighbours didn't expect. And as border closures have been slowly wound back and lockdowns have been slowly wound back, ASEAN member states are making bilateral rather than regional agreements about travel corridors, which have longer-term implications for the recovery of places like the Philippines and Indonesia, whose management of the pandemic have put them on the back foot. But other scholars say that this diverse range of responses is not unexpected. ASEAN policies are never expected to replace national policies, and so this mixed response is perfectly normal. Regardless, what is clear is that ASEAN, in order to support the countries of ASEAN to recover from this crisis, ASEAN will have to contend with significant challenges in the economic recovery of the region. And this is something that Sandra will go through in her video and podcast. But equally important is the impact that this pandemic is having on people living in rural areas of Southeast Asia in precarious circumstances, an issue that Jeff Nielsen will cover in his podcast and video. Having experienced the pandemic and the challenge of managing this all-encompassing and extended crisis, ASEAN and its member states should be aware of the importance of preparing not only for future health crises, but also for the potential political, social, and economic crises that may emerge from this. We hope you enjoy the event. Please don't forget to join in on the conversation by posting your questions and comments on Facebook or YouTube or on Twitter using the hashtag ASEAN Forum 2020. I look forward to collating all your responses and putting them to our presenters next week. We'll see you then. Thanks.